Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our educational series for parents. Please remember these videos are not intended to replace consultations with your doctor. If you have concerns, if you'd like to be seen, give us a call. We'll be happy to see you here at our office. Area code 775-359-7111. Today what we want to talk about is allergy medicine. Things are starting to bloom, allergy season is beginning, and so allergy medicine is becoming more and more prevalent. The first thing that's important to realize is that babies, children under 6 months of age, almost never have allergies that require allergy medicines. Stranger things have been known to happen, but don't self-diagnose this one. See your doctor if your child's under 6 to 12 months of age, because seasonal allergies in babies of this age are pretty rare. So what we're talking about are medicines for older children, preferably kids who are 2 years old and up, or children who've already been prescribed medicine by your physician. They come in various classes, and I just want to talk about the roles of each of these medicines so you understand how they overlap and what you can do if one medicine's not working for you. The first group are the antihistamines. Antihistamines are the oldest of the allergy medicines on the market. We've used them for years. Everybody's familiar with one of the older ones, Benadryl, which is over the counter. Benadryl is a very potent antihistamine. It works very well. In fact, it works better than anything else. It works so well that when you come into the emergency room with life-threatening allergies, that's the one we're going to give you intravenously. However, Benadryl has one rather unpleasant side effect, and that's that it tends to make people very sleepy. And although this side effect can wear off over time, it can be very unpleasant, especially with school-age children. We don't want them falling asleep at school. That gets them in trouble with their teachers. And that kind of limits its use. The other problem with Benadryl is that it's short-acting, has to be given about 4 times a day. Benadryl still serves a purpose. It is useful for breakthrough allergies when nothing else is working. If your child is so miserable that they can't sleep, Benadryl is a good choice. It will A, make them sleepy, and B, be most likely to stop the itching so that they can sleep. There are over-the-counter longer-acting antihistamines, though, that are very good, very safe, and very effective, much less likely to sedate you. That's over-the-counter loratadine, which is the generic for the name brand Claritin, and over-the-counter cetirizine, which is generic for the name brand Zyrtec. They come both as liquids, chewables, and swallowables, and they're quite useful. I'm not going to get into how to dose them here. That's between you and your physician, but I want you to understand their role. They block the end product of allergies, that's something called histamine, and as such often help make you feel better with both itchy runny eyes, runny nose, sneezing, skin rash, itching, hives, all that come with allergies. So they work to help symptoms everywhere. Zyrtec is a little more sedating than Claritin, but it's also a lot more effective than Claritin, so that's something to just kind of keep in mind. Try one. If it's too sedating, try the other. Try Claritin. If it's not working, go with Zyrtec, whatever you need to do. Older medications used for allergies that really aren't very effective include some of the nasal decongestants, stuff like Sudafed, phenylephrine. That really does nothing for allergies. It stops the stuffiness, but doesn't help the allergies, and is really not something we recommend. For adults in particular, you have to be careful with these medicines. They can raise your blood pressure. If you're somebody prone to high blood pressure, that is a bad choice. The next group of medicines are steroids. Steroids are very potent medicines for allergies. Steroid injections are not something you want to do on a regular basis. They're very dangerous. They risk causing cataracts, thinning of the bones, tendon rupture, so we most strongly recommend you not receive seasonal injections of steroids. Having said that, nasal steroid sprays going directly in the nose if you're having nasal allergies are quite safe, quite effective. The biggest side effect from them is that they can cause bloody noses, and if that happens, that's a reason to stop. The nasal steroid sprays sometimes even help with ocular allergies, with itchy eyes. Now, we put the steroids in the nose, not in the eye, and you say, what is the connection between the eyes and the nose? I don't know. That's not well understood, but several research studies have shown that patients with both runny nose, stuffy nose, and itchy eyes, when given nasal steroids, show improvement in all of their symptoms. So that may be something to do. Also, if you have ongoing asthma that's being triggered by your allergies, this is the medicine that's going to be the most beneficial in controlling your asthma, because there is a nasal bronchiolar reflex, and it can be suppressed by steroids in the nose. Antihistamines really don't work very well to help asthmatics get their asthma back in control by means of controlling their allergies. They feel better, but their lungs are still a mess. If your eyes are the biggest problem and you have no other symptoms, or if your eyes are itchy and can't be controlled with other medications, there are medicines to go directly in the nose. There's something called Patanol, which is what's called a mast cell stabilizer. It helps to prevent the cells that are responsible for allergies from doing their thing, and as such help control the allergies. There's a competitor to Patanol called Zaditer, and then there is an antihistamine that can go directly in the nose called Nafcon-A. There's also an that goes directly in the eyes called Nafcon-A. There's another one that can go in the nose called Astelin that can also be used on top of nasal steroids. But Astelin tends to cause some nasal congestion in patients, and it tastes bad. Patients aren't too terribly thrilled with it unless nothing else is working. Finally, there is oral medication, in particular something called Singulair. Singulair is a leukotriene modifier. It works very early in the allergy cascade, and it shuts down allergy production and allergy cell production early on. The downside, Singulair is very safe. It has very few side effects, but its biggest downside is that it takes a long time to kick in, a minimum of a week, and to have maximum efficacy up to a month, because it actually works at the level of the bone marrow by controlling what cells are being turned out by the bone marrow and altering your response to allergies. The drug is actually quite safe. In rare cases, it's been associated with depression, so if you start the medicine and suddenly your child becomes crushingly depressed, we know we have a problem and need to take you off that medicine. But most people don't have any side effects from it. Singulair comes in chewable and swallowable forms. There's currently no liquid, but that's okay because the chewable can be crushed and suspended into a slurry and given to small children if need be. The other downside to this one is it's expensive. And it needs to be given every day whether you need it or not. But it's not sedating, and it works well in combination with all of the other drugs. So I hope this has helped to kind of dispel some of the myths about what these drugs do and why we use various combinations and the various categories, the topical steroids, the topical antihistamines, the oral antihistamines, and Singulair can all be used together to help control your allergies. We prefer to do this over doing something like allergy shots, because the shots are only effective against the specific things to which we're injecting. So if you're allergic to elm and ragweed, but we only inject ragweed, well, then that doesn't do any good for elm. Now, that's not much of a problem here in northern Nevada, but you suddenly move to the East Coast where there's a lot of elm trees, and now you've got problems. Didn't even know it was a problem because you were never exposed to it before. We took care of your ragweed, which is not such a problem on the East Coast. Which is why the medication works, and that doesn't care what you're allergic to, so that's usually the first way to go. Plus it's a much more pleasant way to treat things. If you're having ongoing concerns, if you have allergies, if the over-the-counter medication is not cutting it for you, make an appointment to see your physician. If your asthma is flaring as a result of this, absolutely see your physician as soon as possible. We'd be happy to see you here at our office, area code 775-359-7111. Again, this is Dr. Windisch, and I'll see you next time.